Welcome to Your Health Today, providing you advice on staying healthy. From the DuPage County Health Department, I'm Public Information Officer Don Bolger. Today, we're discussing influenza, better known as the flu. It comes around every year between October and November and stays with us right through April or May. Joining us for this edition of Your Health Today from the DuPage County Health Department, our medical officer, Dr. Rashmi Chugh, and our school health supervisor, registered nurse, Bev Govednik. Thank you for joining us.
Thank you.
So let's get into this talking about flu. But first, what I'd like to do is an elevator speech. Tell us in 30 seconds or less what a medical officer does.
Well, as medical officer, I primarily oversee disease surveillance and prevention and serve as a medical spokesperson for our health department.
Okay, that was well under 30 seconds. That was perfect. Bev, school health supervisor.
I coordinate our immunization program and travel clinic program. I'm also the liaison to the schools, preschools, and daycares in DuPage County.
Okay, so you see a lot of kids and what they have to do with the flu. We'll get into that shortly. Dr. Chugh, flu season is here. And let's start with the basics. What is the flu?
Influenza or flu is a contagious respiratory illness that's caused by one of the influenza viruses. And it can affect anyone of any age and even otherwise healthy people. It can be mild or it can be severe, including sometimes causing hospitalization and rarely death.
Wow. Now, some people may confuse the flu with the cold. What's the difference between the two?
It's a good question. Influenza typically causes a more severe, abrupt illness, abrupt onset of fever, headache, respiratory symptoms such as sore throat or cough. They may also have congestion, but that's less common than it is in cold. A cold is a milder respiratory illness that is more associated with runny nose and maybe some cough and congestion.
So the cold may just kind of ramp up a little bit, and the flu, bam, just hits you.
Typically, right, like getting hit by a truck.
So how does someone get the flu?
Well, it is transmitted typically person to person by respiratory droplets. So either if someone near you was sick and was coughing and sneezing, then if you inhale a droplet, that can lead to infection. Or if you're having direct contact and if through their cough or even by talking with someone, you can be infected by a droplet. Or if you touch a contaminated surface that had someone's secretions on it, and then you touch your eyes or nose or mouth, then you can get infected that way too.
We'll talk about avoiding that stuff shortly too. So who is more at risk of serious health problems because of the flu?
Right, good question. Typically those at greatest risk are persons 65 years and older, so our elderly, as well as young children under 5 years of age, but especially those under 2 years of age, as well as pregnant women, even through 2 weeks past their delivery, and really anyone with underlying health conditions such as asthma, diabetes, heart disease.
Okay, there are always new types of flu. What can we expect this year?
Well, the one thing we can expect is that it will be unpredictable, as every flu season is, but we do know that flu activity, we do anticipate it'll ramp up in the coming months through the fall and the winter. It typically peaks around December and March, but sometimes even as late as May.
So, good information to know. Let's talk about kids.
Sure.
Bev, as you mentioned, young children are at risk. Dr. Chugh mentioned young children are at risk.
Yes.
Unfortunately, we could see some serious health problems if they catch the flu. As school health supervisor, how can children be protected from catching the flu?
Well, number one, of course, is to get the flu vaccination every year for your child. If they're 6 months of age and over, they can get vaccinated with flu every year. There are different types of vaccines, so talk to your healthcare provider about which one is best for your child.
By vaccination, you mean actually getting the flu shot?
Or there is a missed form of flu vaccine, so it would be a conversation with your healthcare provider, which one is best for your child. So you want to teach your children good hand washing, number one. So every time they cough, before they eat, they want to wash their hands with soap and water. They want to sing the happy birthday song twice, scrub their hands that long.
That's perfect.
A great thing to teach
It's
them.
an easy song to remember, too.
Absolutely.
Everybody knows that.
That's right.
Absolutely.
Right.
It's also good to teach them to cover their cough every time, either with a tissue or cough into the corner of their elbow. That helps contain that cough as well.
You don't see this as often. That's something I learned maybe 10 years ago, and I practiced that often.
Good.
Had no idea at that point that I was really helping contain. And speaking of contain, several years ago, I got hit with the flu. Hit me on a Friday night. And like you said, like a truck. I was in bed on Saturday, missed a friend's wedding. He was not happy, but you know, what are you going to do?
Right.
I was in bed with the flu until the next Thursday. Wow. But by doing so and not going to work, I was a good boy, right?
Yes, you were.
Yeah, you absolutely want to prevent spreading and further transmitting influenza by staying home if you're sick.
Yep, great example. So, when is the best time to get a flu shot?
Best time is now. We absolutely recommend, as Bev mentioned, everyone 6 months and older should get their flu shot. And it's not too late, even if it's into the holidays, but the sooner the better.
And why is this important?
Well, we want to prevent people from not only getting sick, but from preventing, we want to prevent transmission and also prevent the complications associated with flu, since it can be severe. As I mentioned, it can cause hospitalization and sadly, rarely, sometimes death.
And as we wrap up, how long can this season last?
Well, typically it lasts through May with some activity, but we'll see a peak before we see a decrease. So sooner is better to get that flu shot.
Bev, as a reminder, those 3 C's.
Clean, cover, and contain
So
your cough.
clean means?
Clean means wash your hands frequently.
Sing the happy birthday song.
Yes, twice.
Okay. Cover.
Cover your cough.
Okay. And contain.
And contain, please stay home when you're sick and keep your children home when they're sick.
Okay. Very good information. Thank you very much for your time.
Thank you.
Remember, to find where you can get a flu shot, go to vaccinefinder.org. And all this preventive information is on our website, dupagehealth.org/flu. For Dr. Chugh, Bev Govednik, and the DuPage County Health Department, I'm Don Bolger. Thanks for watching Your Health Today.